The right to health and safety at work is a fundamental human right. A safe and healthy work environment not only protects workers but also enhances productivity, drives business growth, and supports sustainable development. Globally, there is a growing commitment to safeguarding workers' well-being through robust regulations and best practices in occupational safety. The Malawian government is actively contributing to this global effort by working to develop a more efficient and effective employment injury system that aligns with international labor standards on social security, Malawi's Decent Work Program, and Malawi Vision 2063. To advance these objectives, Malawi's Ministry of Labor requested the support of the International Labour Organization in facilitating a technical exchange visit to Zambia's Workers' Compensation Fund Control Board. Held from March 24 to 28, 2025, the visit offered a valuable opportunity to share knowledge and expertise on designing, implementing, and managing workers' compensation fund systems.
Workers' Compensation Department in Malawi, it derives its mandate from the Workers' Compensation Act, number 7 of 2000. This act, it provides for the procedures which are to be followed in case of injuries which are sustained in the course of one's employment, or if such injuries results into death. Basically, the Act provides like two systems. The first system is the individual employer liability, where the employers take the responsibility of providing compensation for injuries to workers. And the same Act, it also provides for the establishment of the Workers' Compensation Fund. In this case, the responsibility to provide compensation lies in the fund. However, the fund is yet to be operationalized. So the system which is prevalent as of now, it's the individual employer liability.
The employer liability system has a number of gaps. One of the gaps is that we claim compensation directly from the employer. So as we are doing that, it's the compensation that we claim directly from the employer is not something that the employer has planned. Most of the time they fail to pay compensation there and then, so they take some time, a year or two can go. The other gap was the compensation itself that we pay is a lump sum. So once somebody gets that lump sum, unless they are very good in managing their finances, but what we have observed after they have finished their money, which is also a very short time they take to finish the money, they most of the time they go back to the station. So it's like we are putting people into poverty.
And in the end, you find that most of the workers are not well covered in terms of compensating them and treating them for sickness. And also on the other side, what that means is that it leaves a lot of benefits that are not covered because it's not within the capacity of the employers to be able to provide for those benefits.
The whole workers' compensation is under Ministry of Labour, and all the operations are directed by the ministry's officials, senior officials, whereby in our viewing as the Malawi Consultative Union, we feel like it's not properly managed, properly arranged, since the Commissioner for Workers' Compensation decision is not final. It depends also to go to the ministry officials, the principal secretaries, and the Labour Commissioner. And at the same time, it takes quite a long period of time for somebody to be compensated.
We feel that with the current system that we have, we do not have the necessary expertise that would help us in assessments as well as determining the compensations that should be paid out. Therefore, the whole landscape at the moment, we believe, is not only unfavorable to employers, but it is also unfavorable to the workers that we want to help because of the problems that we are currently facing. There are delays in disbursing the compensations towards the workers.
The ILO is overseeing, supporting the employers, the workers and governments in Zambia, Malawi, and Mozambique as the ILO country office in promoting and developing a comprehensive social protection system. So with that technical expertise, we saw that it would be important for the government and the social partners in Malawi, in view of the current gaps that we have in our current workers' compensation in Malawi, that they should learn from a country that has been implementing the workers' compensation fund. And one of the countries that we identified within the region, for obvious reasons, because Zambia is within the country office as Malawi, and also because Zambia has advanced in the implementation of a workers' compensation fund, which we know now that it has a wide range of benefits that they are covering.
Through the interactions that we have been having, we met them last year in Chisamba during a workshop on the Convention 102, which is the minimum standards on social security. Through the presentations which they made, it clearly highlighted how effective their system is. So our coming here basically is simply because we knew that our colleagues here, their systems are effective. So we want to learn from them so that we can have a system which will be facilitating workers' compensation in a very efficient and effective manner.
We're actually excited that the Malawi delegation picked on Workers' Compensation Fund Control Board, Zambia, as one of the learning institutions. We have been in existence prior to independence, meaning we have certain experiences that they can learn from, and hopefully it can assist them actually in setting up their own employment injury scheme in Malawi.
Yeah, now Workers' Compensation Fund Control Board is a social security scheme constituted under Act number 10 of 1999 of the laws of Zambia for the primary purpose of providing compensation to workers in the event of occupational accidents and diseases which lead to disabilities and, in unfortunate circumstances, sometimes even death of workers. We have a broad-based clientele. I will segregate it by two. The first being the employers. This is an employer liability, which means that the scheme is financed by employer contributions, which we otherwise call as assessments. So all employers amenable to the Workers' Compensation Act in Zambia are required to register with the Workers' Compensation Fund within 14 days of commencement of business. The second category constitute workers who suffer disabilities in the workplace. We might even add the third limb of workers who are not yet injured, who have not yet contracted diseases, but for whom we write the workers' compensation policy to protect them if and when they should get injured or contracted disease, then they receive the benefits.
Being the employment injury scheme, the contributions are actually made by the employer, in short the companies, on behalf of the workers. How are the contributions made? So, the contributions are determined by the type of business that a business house is actually involved in. So depending on the kind of business that an employer is coming from or they're working under, then there will be different risks associated to that business. So that's going to determine what we call the assessment rates that we use to levy the employers. And then we also look at the earnings that are declared by this particular employer.
By law, the employer is supposed to report an accident to Workers' Compensation Fund Control Board within 3 days of gaining knowledge of the accident. So it's an offense for the employer to know that there's an accident and they don't report it to us.
There is what we call accident claim form number 6, which employers complete to notify us of an accident or incident of disease the employer is required to complete it within 3 days of gaining knowledge of an accident, and they send that to us, and that then triggers the compensation procedures. We subject the claim to analysis, and if it satisfies the conditions pertaining to ascertaining that the accident occurred at work and that the worker was injured and disabled, we subject such a worker to a medical assessment board to determine the degree of disablement suffered.
When someone is injured, we don't start compensating immediately, because for us to start compensating, a degree of disablement has to be determined. But if the wound is not static, we can't start compensating or paying compensation. We have to wait for the injury to stabilize. Then from there we have to assess of the degree of the disablement, because that degree of disablement is what determines how much they will get as compensation.
Once we've been given the degree of disablement suffered, then we use that degree of disablement suffered to calculate the compensation that we should pay to the worker. We have several benefits that are provided. Lump sum payments that we give in respect of disabilities suffered at less than 10% degree, which to us is called temporary disability, and these are just one-off. We also have periodical payments that we provide in the event of a worker suffering an accident or disease, contracting a disease, and they are undergoing hospitalization or treatment. During that period of absence from work, the Office of Commissioner provides periodical payments. We also have a life pension that is granted in respect of disabilities assessed at more than 10%, between 10% and 100. We place workers on a life pension, and where unfortunately we experience fatalities, we place the surviving family members, especially the spouses, on long-term benefits, which are also monthly payments, and those also are supplemented by child allowances to support those that are still going to school up to age of 18. And sometimes we experience situations where a child is still going to school and they're above 18. We do extend up to 21. We also have workers who are not married. They also do not have children, but they leave behind the guardians. These are people who were wholly dependent on such individuals, and when they die, we extend what we call guardian allowances to those individuals. The other category of benefits that comes to mind is funeral grants. When workers die as a result of occupational accidents, we provide funeral assistance. Is another form of benefit. Those workers who are able to return to work, we give them another service under the rehabilitation wing, which we call Return to Work. So we sponsor them to various colleges or schools or universities to acquire alternative skills, which then they use to enter the job market. And over and above that, we provide medical aid, which comes in the form of assistive devices, treatment, long-term treatment and care at hospitals. In fact, it's lifelong care for them because they are permanently disabled. We also do provide psychosocial counseling to help our colleagues to live with the conditions that otherwise they acquire as a result of occupational accidents. And last but not least, we provide gratis occupational health and safety services to promote safety in industries. So we have invested in ICT platforms to automate the processes for receiving claims, payment of compensation, and also receiving contributions from employers. We have also introduced some customer-related initiatives on the ICT side. We have live chats. The workers and the employers can chat with us through our website.
We are one of the very active participants, I think, in the local economy in terms of infrastructure development right now. In short, what I would say is that the excess money that we get from assessments, we have invested in various modes of investment.
We do not apply all the income collected on payment of compensation for obvious reasons, that not all workers get injured at the same time. It's a game of probability. So the surplus funds are applied into investment vehicles. So we have an investment portfolio under the fund, which consists of investments on the capital market, investments on the money market, investments in property, and most recently through debt instruments we have been able to invest in infrastructure such as roads, and we are recovering our investments through the tolling system and so forth and all that. We have also in recent memory attempted to go in forestry, plantation, to put our long-term investment there. So we are quite innovative in the investment space as well. As you know, the issue with investment is placement of funds in instruments that can help you beat inflation, so that you preserve the capital, you preserve the funds that are under management to avoid facing deficits and also liquidity challenges. Yes.
This is the best time, the best window to have a design that is going to fit the workers of Malawi and fit them in a gender way.
Zambia was a very good example and a case to learn from in view of the progressive development that we have seen. It's on Workers' Compensation Fund Control Board. We are taken to some companies that showed us on how they have automated their service provision, which has made access to the service by the employers and the workers also quite fast and more responsive. And also workers' compensation has progressed in terms of building and providing for a range of benefits aside from just work injury compensation. One of the lessons that we pick is that it's very important for the governance system to have representation, equal representation of key stakeholders. Issues that needs to be taken into account should be more inclusive in terms of, because the workers' compensation would say it's a scheme that actually by nature it promotes inclusion of persons with disabilities, because some people who get injured might actually live with a disability. It's also important to take into account how the issues of coverage to the informal economy, because we learned that even here in Zambia, workers' compensation has developed strategies, and they have started mechanisms on extending to the informal economy, because we know that both in Zambia and Malawi, the informal economy form the bigger part of the labor force.
One of the things that we have learned from our colleagues is that they have got a good structure which has got directorates in all the important areas. Then we have also seen another very important area, their ICT system. It makes the whole process simple. Out of interaction which we had with the employers and some of the beneficiaries, you could see that upon reporting an injury, in less than a month, something has been done. We saw that registration of employers, for example, it's done online. Processing of payments, it's done online. Even approving the compensation itself, it's done online. So this makes the whole system, to be very efficient. And another important area that we have learned out of one of the stories which we got from a beneficiary somebody got injured, the leg being amputated, the way the workers' compensation handled the issue, it was like very encouraging, because this person, we learned to say, after he was incapacitated, he couldn't no longer do the work that he was employed to do. What did the organization do? The organization, they decided to redeploy. So the redeployment was possible because of the rehabilitation services which also took place. Out of the rehabilitation, they also did a retraining. So somebody who was working as a marketer has now been trained up to a point of being a lawyer. See, so that is just, telling us how good the system is here in Zambia. And we believe that even when the Workers' Compensation Fund is operationalized in Malawi, we also have such beautiful stories. We have learned to say, for the sake of sustainability, you should be able to have, investments which will be able to bring at least a return. We have also learned something to say, we need to do a very good risk assessment, and we should be able to manage our investments well. Yeah. And they are able to do that here simply because they have got a directorate specifically for this. So if you have a directorate which is specifically for investment, surely they are able to do their work well. They are able to do wonderful research in terms of what type of investments can we undertake. When you look at the Workers' Compensation Act in Malawi, it says it is an act to provide for compensation for injuries sustained in the course of employment. So we have learned from our colleagues to say, you do not compensate for the injuries, but you compensate for the incapacity. These are some of the strengths that we need to have in our laws. There is a very good synergy here between the provision of compensation and the provision of occupational safety and health services. So this synergy, it helps, in terms of reducing the occupational injuries and illnesses. What we have learned from our colleagues is that if you have a Workers' Compensation Act which talks to the Occupational Safety and Health Act, then you are able, one, to reduce the occupational injuries, and whenever an injury occurs, the way you handle such an injury, you handle it to an extent of supporting the injured workers to a point that they can either return back to work or they can still more be able to do something to earn a living.
The legal framework is the one which has impressed me because I've noticed that the members of the fund, that the employers themselves, and the employers, they have to be justice to their workers. They have to register their workers according to their establishment. In the system itself as well, the way they are keeping their records, it's another impressing issue, so that each and every employee might go to the fund authorities and make sure that his or her name is appearing in their system.
There are two stories that fascinated me. One is a story that I heard about somebody who got injured in 1954. He left work, but the compensation fund was paying him up to the time he passed away. That was, I think, this year, if not last year. So for those 70 years, even though he was getting something from workers' compensation, his employer stopped contributing long time ago. That's what you call social insurance, social security. That's why those were not left behind.
It's been a very good eye-opener, which shows us what we need to have, the basics that we need to have in place if we have to start this fund. It also probably points us to what low-hanging fruits we could start with before we come to a fully-fledged workers' compensation. Things that we could probably start with at the moment before we actually come to operationalizing the fund. Last but not least, of course, we would have to have a trained human capital, trained personnel that would help to run the system. So these are the three basic factors that I think we need to have in place before we proceed with the actual operationalization of the fund.
There are three things to a successful employment injury scheme. One, adequacy of benefits. The benefits should make sense. The benefits that we give to people should make sense. The second is efficiency in settlement of claims. The last bit of it is prudent management of the funds, so that the institution is able to meet short and long-term liabilities that come with such a responsibility.
For me, I think as they start the ball rolling in their country, I think it's important that their setup is grounded in a statutory arrangement. It becomes easy for enforcement of compliance, because if it's left to be an option, it will be very difficult actually to start up in Malawi. So if they are able to pass legislation where they compel every employer in Malawi, including the public sector, that would be the biggest starting point for them.
For our colleagues from Malawi, I would advise that they need to start thinking of ways of ensuring that they don't get hit by, these low compliance, because that in turn is going to affect their operations, and in the end, it will be difficult for them to meet their objectives. You need a very robust information system. So you cannot set up an employment injury scheme without thinking of a robust management information system. That will make things easier for you. Okay, so and that won't be achieved if you have a system that's able to profile the information for employers and workers in the way that you want it, in the way that you can easily access, for instance. A collaboration in the area of employment injury scheme is something that you cannot do away with. You need some sort of strategic alliances that you forge with, for instance, employer organizations, worker organizations. So you need to identify those and see how best you can work. We have that symbiotic, kind of relationship. Yeah, you gain from them, they gain from you. At the end of the day, both institutions, stand to win.
As ILO, we are so pleased to support our social partners through our country director. The ILO is aimed at providing capacity building, technical support, capacity building to our constituents. And for us, this particular technical learning visit, has been very fruitful. We have learned lessons, and we are looking forward to continue supporting government and the social partners in Malawi to design a workers' compensation system that will be able to respond to the needs of our population, but also that is going to be sustainable and contribute to building a comprehensive social protection system in Malawi. Because that is an area that, as ILO, through our country director, that we have keen interest in supporting our tripartite partners in Malawi.